if you were watching the show, we kind of have a medical theme, I think, going on a little bit today. Maybe you've been dealing with some plantar fasciitis or something like that that's causing you some aches and pains, and you're not quite sure where to turn. Sean Jones says, turn to me. He's back on the show with Chattanooga Wellness Centers, and he's talking about the shockwave therapy he does there to help folks. Good morning to you, Sean.
Hello, Julie. It's so good to see you, even though it's a little far distance here.
I know. I feel like we have this flip. In days of old, I was the one FaceTiming with you from your office, and you had to be the one kind of awkwardly having the conversation. I guess today it's my turn. It's weird to be remote with you today.
Yeah, well, it's okay. I enjoy being here. I was always happy to be here.
Well, I'm glad you're on that green sofa. So let's talk a little bit about the shockwave therapy, because we've had this conversation before, and you don't use the shockwave isolated, right? You use it in conjunction with the K laser.
Well, yeah, I can. What shockwave is, it's an expensive, powerful machine, and what it does is shockwave actually tears down old adhesions. So it goes in and it busts up any fibrosis tissue, old adhesions. It can take old joint replacements that are just not functioning good anymore and rejuvenate them. So we can take, that's the machine behind me there, and we can take the machine and go in there and bust up these adhesions. In all different joints, any musculoskeletal problem in the body. And so it's a powerful thing, and on its own, it works fine just doing shockwave. However, if people that know me know I like to stack things in our favor for success. So anytime I do a shockwave, I'm gonna follow up with like K-laser, which does the opposite. It super heals tissue. It decreases pain, decreases swelling, increases blood flow, and makes the tissues heal much, much faster. So after I tear down all the old adhesions, I go right back in with laser and then rebuild the joint. Because our goal is really to try to avoid or greatly delay joint replacements if we can, and get people out of pain fast, and they feel a difference the very first treatment.
So I mentioned the plantar fasciitis because that's something you had mentioned to me, and it stuck in my head. But this is something you can use for all different types of injuries and problems.
Yeah, bursitis, hip bursitis, tendonitis is, any of the itises, any inflammation. Itis just means inflammation. So any joint that's inflamed, and of course, it's a key component to our neuropathy program. We have a high 98% success rate treating people with neuropathy and reversing the pain, numbness, tingling, the falls they have when their balance gets bad as neuropathy progresses. And so we do 3 shockwave treatments during the 90-day program, doing laser treatments and everything else we use in our program for success, because I want to use everything possible. And it's fun too, because shockwave, when I do shockwave, before I do the laser, I usually get a patient off the table and make them walk around before I put the laser on them, and they go, oh my goodness, hey, my joint feels freed up. It feels smooth again. It's starting to work again. My father-in-law has an old joint replacement that's just not doing well, so we do shockwave on that one, and it works tremendous. It loosens it up, and we follow it up with laser. So it does very, very good.
Do you mind if I ask you what the shockwave is? I mean, in my mind,
it's sound wave,
like
yeah.
Sounding.
Yeah, great question. Yeah, it's sound wave. It actually has a $500 little piece of metal that goes choo, 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 back and forth inside the gun, and it creates this noise, but it creates a sound wave. So it's not electrical shocks. It doesn't hurt. It sends sound waves deep into the tissue, and it takes 21 days to get the full effect every time we do a shockwave. So I usually spread it out to just twice a week or once a week when I'm doing shockwave treatments, if you're coming in just for bursitis and things. And usually it only takes between 3 and 9 treatments to pretty much resolve the problem to where they're functioning pretty well and can get by with just a little laser later on if they need a little tune-up on it. It's a powerful machine.
Do you feel anything, Sean, when
oh yeah,
you're doing that?
You feel it. And sometimes when you're on on a small area like a hand, when it hits the bone, it bounces off the bone. You kind of feel it. It's like impulses. It's not pain, but it kind of, if people are hypersensitive, some neuropathy patients are very, very sensitive, then I turn it down some to what they can tolerate. But then we go with the lasers, and we go back in and we laser up the area to help decrease the swelling and pain that they already came in with. And so usually they're feeling much, much better. We do it on shoulders. Shoulders that have been replaced, shoulders that just have bursitis or fixation where they just don't have the motion in it. And it loosens everything up. And it's amazing how fast it works. You see results immediately with it. And it takes a few visits to do it over a course of days or weeks. But goodness sakes, it works tremendous doing that.
Okay, so I'm slow to catch on, I think, because I can't see you face to face, and it's throwing me a little bit. So I want to repeat something. You said it takes about 3 to 9 visits?
Yeah, shockwave treatments. And so when I do the shockwave, I'll make sure that that I do the shockwave treatment, and I got my laser here in my pocket, one of them. And so that's the shockwave machine there. We tear down the tissue, and then we go in and we rebuild it with the K laser. I also use my little hand laser here, and what I do with that is I'll go in and reset all weak muscles. So what I do is I test all the muscles in your whole chain of problem. If it's a knee, hip, or foot problem, we're going to test all the muscles from your low back all the way down to your big toes. And then anything that's weak, I'm going to take my hand laser and reboot it. You can make a weak muscle strong in 3 seconds instead of 12 weeks of physical therapy. Nothing wrong with physical therapy, but I want to make it strong immediately so you see immediate results when you come in Chattanooga Wellness Centers. And
so when you do that and people feel that, you talk about feeling that immediate benefit, whether it is from the shockwave or the K laser, that immediate benefit, is that one experience then permanent? Or like if you do the shockwave treatments, and let's say you do 6 of them, pretend that's your protocol. At the end of those 6, is that it forever, or will you possibly need to come back?
Sometimes people need to. I say it's like when I used to watch Johnny Carson, the guy used to spin the plates on the 6-foot poles, and I thought it was hokey, and within 30 seconds I'm going, hurry, hurry, I'm getting caught up in it. And once they're spinning good, all you got to do is tap it a little bit. The same thing with this. Once we get it running good, whether it's neuropathy or hip bursitis or whatever it is, once it's running good, if you need a little tune-up, sometimes we just need to come in and do a little laser treatment with it. And go in and do that. And this is what the little laser I use to reset all the muscles that are weak in the body. So once your muscles are stable, of course it makes sense, your joint's going to feel better just by stabilizing the muscles around your knee or your shoulder or your elbow or wherever it is.
And I guess what follows too is that once the pain is kind of minimized, now you can become active, and that activity helps to keep things lubricated and keep you strong.
Yeah, I mean, as a doctor of chiropractic, I'll go in and adjust the feet, the knees, the hips. I'll go ahead and mobilize them, because when you mobilize that hip, it pulls synovial fluid back on the surface. It rehydrates the cartilage. The cartilage can wear down, but the other thing is too, instead of doing just laser treatments, we can skip laser, go right into regenerative medicine, because what they used to call stem cell therapy, and we do regenerative medicine at the offices too. So we can go in there and tear it down. Before I do injections, I don't do them. The medical team comes and does them. But I will go in and shockwave the area of complaint, whether it's the knee, the shoulder, back, whatever we're doing, and tear down the tissues, because those stem cells are going to go migrate right to where you tore it down and heal those tissues. And you can actually rebuild cartilage in knees and shoulders and things, and hopefully avoid replacements. If somebody needs it, there's some great people in town that do them. But my job is to try to prevent that or delay that as long as possible, so you never have to go get those done. And it's working well for my wife, my father-in-law, and other people too.
I know you have the 2 locations, Cleveland and Chattanooga. So are you able to do all of this in either location?
Yes, ma'am. I actually it's a $50,000 machine, so I take it on Thursdays to the Cleveland office. So I do all my shockwaves in Cleveland on Thursdays, and then we have it stationed at the Chattanooga office most of the time. So you can come in there. You just call Dr. Sean Jones at Chattanooga Wellness Centers, and we will get you scheduled for a free consultation. We'll sit down and take a history on it there, and I'll make recommendations. Sometimes you need shockwaves, sometimes you need something else. Sometimes I find you have neuropathy. Then we do the whole neuropathy program. We do a $49 visit and do the whole neuropathy treatment during that visit, and let you see what it's like. And when you come back, we see how well you responded to the very first treatment. Knowing Rome wasn't built in a day, it takes some time to build up. But over 90 days, we can reverse that neuropathy and get people feeling better, get your joint pain better, get your bursitis better. Any joint pain or problem you're having anywhere from the nose to the toes, we can help with shockwave, K-laser, and of course, the chiropractic care that we do.
And that's that magic number he likes to talk about. 90 days is what he asked you to give him before you're going to feel better. Chattanooga Wellness Centers, as you heard him mention, Cleveland and Chattanooga. If you want to go online, shockwavepain.com is a great website for you to check out. Just give them a call. The phone number is right there on your screen. Dr. Sean Jones, thank you so much.
Thank you, Julie.